unmute everyone, so you might want to unmute yourself, and I will turn it over to you guys.
Thanks, Erin. All right, we'll get started. We'll start with everybody that's on the TAC can introduce themselves. I'll start. I'm Anlin Purdon. I'm the TAC chair, and I'm with Hazelwood Home Health and the Kentucky Home Health Association.
I'm Susan Stewart with the Kentucky Home Care Association, and I work for Appalachian Regional Health.
I'm Evan Reinhart with the Kentucky Home Care Association.
I'm Marlene Reynolds, and I am with LHC Group.
Is Teudis on?
I don't see him just yet, so I think
Okay.
we can go ahead and move forward.
All righty. Do we have a motion to approve the minutes from the February 15th meeting? I believe those were sent out.
Make a motion, Susan?
I'll second it.
All in favor?
Aye.
All right, looks like the next on the agenda is DMS follow-up to the TAC recommendations from the last meeting.
I have those out to all of the directors in their respective areas. They're due back to them May 9th is when they're due to the MAC. And I will let any of the directors that are on give you any updates they may have for their area in particular.
Thank you.
This is Lee Geist. The only thing that, and I'm sorry, but the only thing I can remember, I'm sorry, I'm saying the only thing I can remember is the supply only recommendation. So we are working on that. It's not an easy process, but we are working on it.
And Lee, just to clarify which part of it. So we had two parts, getting the MCOs to publish their limits, and then also getting them to kind of have a single standard across the board. And then the other side of it was moving supply only to DME.
Right. So I'm talking about moving the supply only to DME.
Okay.
Sorry.
Thank you.
This is Angie regarding the published limits. There has not been any movement on that yet.
Thanks, Angie.
And I believe the other recommendation was the HCBS, is that FMAP funding plan?
Correct. I don't know if I think they said Pam was jumping on or going to get on at some point.
I'm on. Yeah, I'm on now. I'm on my
that.
phone. I'm having trouble getting Zoom to work on my computer. So, but I am on.
Is there any feedback on the HCBS plan to include home health and private duty, Pam, that you have?
Well, actually, there will be based on the budget bill. There will be some changes to that plan. So look for information on that coming out in the future. We have had to really kind of pause any going forward with anything while we address what was in the budget bill. So there's not really any updates on anything right now. The only thing that we are still working on is the rate study.
Right, if there's nothing else on that, then are we ready to move on?
Yep.
Okay. Looks like our next item is MCO updates, common billing issues, common PA issues, any other home health specific issues. Anybody want to take that away, Anthem or Humana?
Hey, this is Holly with Anthem Medicaid. We don't have any updates to report at this time. Nothing new.
This is Jay Mingus with WellCare. I'm saying we have nothing new to report this time.
This is April Levens with Humana, and we have no current updates as well.
This is Crystal Reisner with Aetna Better Health, and to my knowledge, we don't have any issues or anything at this time.
I believe, Susan, was this yours? Did you have specific items that you wanted them to address?
No, I don't
Okay,
know
this
that.
one yours. Okay, I'm not sure. Evan, do you know, was this somebody specific?
We were just looking for updates generally, but I think it'd be nice to understand from the MCO side. We have a couple of examples there. Common billing issues, common PA issues. I mean, we know they're out there, we know they're happening. So we can gather some examples on our end, but it'd be great if the MCOs had some information on their side, just so we can, keep our ear to the ground on what's happening and what MCOs are seeing on their side, and compare that to what we're seeing on our side.
I think we'll just put this back on for next.
This is Dr. Tom James with Passport. I'm the Chief Medical Officer there. I can just say that one of the things that we would like to be able to work with the home health TAC on is a common way of reporting progress towards goal. If you have wound care, how is this person responding or not responding, so that it's more about a collaborative effort towards what the patient's needs are, rather than just setting arbitrary limits. Does that make sense?
I think so. Do you have specific examples where we can kind of point? Do you have anything prepared on your side that we can use as kind of a template to guide us?
In just the kind of discussion that you were taking beforehand, we could prepare something. But the concept is that as we are starting to look towards the reviews as they come in, and recognizing under HIPAA that it's the minimum amount of necessary information to be able to make these determinations that a person is making progress, being able to come up with some, and I can give you an example of a form that we've been considering and is on our website, but it may be something that collaboratively we can work together for reporting that shows progress for the patient who's having home health services. And if there is somebody that I can send that to, or send our form that's on our website right now to Angie Parker or somebody else, we're happy to do that and get some conversation going.
Could they go ahead and send that to you, Evan? And then
Yeah, that'd be great.
Get out to the committee.
I'll put my email in the chat, and
perfect.
We can disseminate this and out to members and get the conversation going on our end, and we'd be happy to facilitate even kind of a working group to figure out some ways to have some best practices for collaboration.
Good, thank you.
And Dr. James, if you wouldn't mind including me on that email, this is Angie Parker.
Yep, I see the ring around your name there, Angie. I'll come off camera so I don't hurt anybody's eyes.
Thank you. We'll get started on that.
Yeah, we appreciate the suggestion and look forward to working with you on that.
Yeah.
Good.
All right. So we ready to move on to the next item? Next item is update from Commissioner.
I believe the commissioner is currently on a plane on our way to a conference in Texas. One of the directors, if I misspoke, please let me know, but I don't think she's going to be able to attend today.
No, that's, I was getting ready to speak up. The commissioner is traveling today and is not available. I don't know that we have any specific updates today. We're in a space where we're working on a lot of things, but none of them are going to happen in the next couple of days. So that's what I can tell you about any updates. Does anybody else have anything to say? I don't want to mean to hog.
All right, we'll move on to number 6 of the agenda, update from DMS departments with any home health topics.
Excuse me, I didn't mean to cough into your all's ear. I think I gave the only update I have earlier. So thank you.
Okay, anybody else before we move on? The next item is supply only for pediatric patients, which I believe the department had reached out to Evan about that. So I'll let him talk about it.
Yeah, so we received a question about supply only cases for pediatric patients and where that really stood, you know, with respect to KHCA members and how home health agencies were handling that. I sent a response to Angie and her counterpart, but wanted to bring this up for the TAC just to have a discussion, not only on the pediatric side, but supply only more generally. You know, the consensus is that it seems like agencies are struggling with the financial end of the commitment to do supply services. Often, you know, there isn't significant margin in that service to begin with, and the amount of administrative time it takes to ensure that the supplies get from one place to another, that the correct supplies have been ordered, you know, that the patient and their family are getting the supplies that they want. All of that taken into consideration really puts the service in a situation where, you know, it is not a profitable service to provide from the agency's perspective. So that was the feedback we got, and, you know, we're certainly happy to continue to gather information. And I've asked some of our private duty members, and, you know, it seems like they tend to try to work with DME companies, but don't provide the service directly themselves either. So in that respect, you know, it seems like majority of the time this is going to flow from the DME side of things, and home health agencies there are some that have a decent sized supply only service line, but many are sort of exiting or not taking on that service just because of the impact it has financially and otherwise. So wanted to bring that up. Angie, I don't know if you have anything else in terms of feedback from your end. Appreciate the answer we got earlier. I know we had a question about whether or not an MD has to sign the form to order supplies, and it looks like you can have an MD, nurse practitioner, and I think one or two other, maybe physician's assistant, can sign the form to order supplies. So that got us an answer to that question. So appreciate that. But otherwise, I think that's where things stood, and that kind of leads us into our recommendation. But Angie, I don't know if you have anything else on that.
I just want to confirm that this is for our EPSDT, Special Services Pediatric Patients. We have been having a lot of challenges in locating certain providers for certain services, most often wipes and those types of things. So we had reached out to Evan to see what your organization thoughts were on this, to see if they could also help with us locating and providing these types of special services to this population, the PSDT population. So any assistance would be helpful.
And I think the number of home health agencies that do provide EPSDT special services, that's even a smaller group of folks out there, and seem to be kind of somewhat concentrated in the public health departments as well. I know that was sort of a core service for several of them, and as they, continue to sort of consolidate and look to exit the business, that'll continue to be, an issue that heightens as we move forward. So we'll definitely keep an eye on it, but I think that's our feedback for now. Anlin, Susan, Marlene, I don't know if you have anything else in addition on top of that.
Actually, Angie, you just said wipes. I don't believe that that's even on our fee schedule. For now,
it wouldn't be.
Okay.
I mean, an EPSDT special services such as those type of things we would cover outside of that, sometimes could be covered outside of the fee schedule.
Okay.
If it's determined to be medically necessary for this particular situation, that's where that comes into play. And that's why we're having challenges in locating providers to provide certain things.
And Angie, I just wanted to also.
Go ahead, Pam.
Can y'all hear me? Okay. EPS is not a program, it's a benefit. So just wanted to make that's understood.
You're cutting in and out.
I'm
Pam.
sorry, this is the court reporter. You were cutting out.
Okay, let me just, I'll put it in the chat.
Sounded like she was saying that EPSDT special services is not a specific program, that it's a benefit that is provided to those particular consumers.
That is correct. If I said program, she's right. It's a benefit.
Right, and Green River District Home Health do offer EPSDT special services, and we offer supply only to our EPSDT special service patient. While the challenge is reimbursement, getting paid for those services, we find that we provide the services that are deemed to be medically needed. We get a PA for it, but then we're having a hard time getting paid for those.
Well, when you are having, Leanna Trainer is the branch manager, if you're not familiar with her, and I can put her contact information in the chat. But if you're having challenges with that, you can contact her. I do know that CareWise, aka Gainwell, does the payment of the claims. You get the authorization through them. But we also on our end help facilitate that. So we can certainly assist if you have certain particular claims right now that you need our assistance with. And I'll put, like I said, I'll put her contact information in the chat.
Okay.
So is that why it's not profitable to be supply only, or is the reimbursement making it not profitable?
It's both. So the reimbursement is low, and I don't think it's been adjusted, for a significant amount of time. So there are all sorts of administrative obstacles to just getting the supplies when they need them, and having them be the correct supplies. And then you got to try to get paid on top of that. So I think that's what Teotis is pointing out, that in addition to making sure everything's good, the supplies get there, we're all squared away, then you have to go down and chase payment. And by the time you've included all of that staff time in, what it takes to go from ordering the supplies to getting paid, you're just in a situation where, you're in the red pretty quick.
This is Susan. I would just add that, we used to have a large supply only population, and it's dwindled due to reimbursement and the administrative burden to try to administer. But, even in the home health world today, the increased cost of supplies is outrageous. So, the minimal margin we might have had 4 years ago is completely eroded now because of the supply chain issues due to not being able to get supplies. And then it becomes a quality issue after that and a patient satisfaction issue.
I was going to say that under traditional Medicaid and the old way of doing it, it probably wasn't as hard because you get cost reimbursed on it. But then after we started with the MCOs and they have fee schedules, then you've got to look at, making sure you're not losing money. And then somebody calls in and they want the diaper they were getting under traditional Medicaid, but I can't provide that one to them because I'd lose money on it. And it goes around and around and around. So especially with getting fee schedule payment through the MCOs, that has made it hard.
And I would say it also ties back to our TAC recommendation regarding supply limits. You don't know what you can and can't bill, what the limit is. So it's a guessing game. And then it subsequently gets denied, and it still leaves an administrative overhead to try to bill and collect for what you're due. So, I think that you might get providers back in the game when we have those billing requirements, maybe.
What billing requirements exactly are you talking about, Susan?
Like one MCO, it might be, the billing requirements might be 50. And if they come in boxes of 30 and they need 2 boxes, then you're,
okay. I see what you mean. Yeah.
And then one MCO might be a billable at 30 quantity, and another one might be billable at 50. But we don't know what that magical number is. So if you go in, your claim is over that, it's automatically denied for excessive supplies. From our seat, it's a game we play with an MCO to try to figure out what the magic number is.
All right, I think that's the talking points there on number 7, and we're ready for number 8 then.
All righty. TAC recommendations for home health and supply reimbursement. You want to talk about that one, Evan?
Sure. Yeah, I think our conclusion in our discussion is that given where things are in terms of reimbursement, both for supply services and home health more generally, that we would make a recommendation that both be increased significantly to address the past lack of increases, as well as the current needs of the industry. So, I think specifically we'd like to see increases, somewhere in the neighborhood of 50% down the road.
Did you say 50?
That's correct.
Okay, thank you.
Any other discussion on that? Susan, Anlin, Marlene?
For the court reporter's purpose, no, I don't have anything else to add. She can't record my nod.
I don't think I had anything else to add other than what you've already said. I mean, it has been a long time since we've had an increase, and we all know that the cost has not went down. So it would be super helpful for us to continue to provide services to Medicaid patients. So with that, that is the last item on the agenda, unless there's anything else anybody wants to say for the good of the order.
I'm sorry, if that's a motion, you'll need a second and a vote.
Yep.
Oh, are we making a motion? Okay.
Yeah, make it a formal motion to increase reimbursement for home health and supply services by 50%.
I second
A
that.
second.
All in favor?
Aye.
Aye. Looks like it's unanimous. All righty. Anything else?
Nothing on my end.
All right. I want to thank everybody for being here today.
Thanks, everybody.
Have a good one.
Thank you.
Everybody have a good afternoon.
You too. Thanks.
Right.